How would you know if you have gum disease? Well, you might be told that you had bad breath. You might notice that when you brush your teeth, your gums bleed. Your teeth might feel a little loose to you. You might notice that when you chew your food, you get a little discomfort or maybe a bad taste from the gums. You might even see some swelling around the gums. From my standpoint as a periodontist, I want to save people's teeth. Where we can, treatments are very, very gentle. They're done under local anesthetic. Patients do very well. With the anesthetic, it probably feels easier than a regular dental cleaning. So we try to be gentle. We try at all times to think about the patient's comfort and treat them in the most complete way. But also keeping in mind that we want them coming back, we want them to feel comfortable, and we want them to be happy about the treatment that they've had.